Took radiographs for balance for the farrier, lateral from the outside, inside, and front to back. The left front actually has a pretty good palmar angle, good breakover. With these shoes that he's in, it would be nice to have a little bit more heel coverage. The medial to lateral balance, if you want to look on the screen, basically these arrows should all be in parallel with one another. And when I darken it up, you can see that the marker, which is on the outside, this horse is too high on the outside for the way this foot wants to go. So these lines are really oriented, converging, and then it's reflected basically in the joint spacing, convergence of the pastern and then convergence of the coffin, and that's on the left front. If you look at the right front, we actually, Chip's done a nice job of backing the toe. The palmar angle as measured here is actually, it's -1 degree. Pretty good solar depth, 22. Again, the way this foot is also running is like we have zero heel, and we have quite a prominent broken hoof pastern access. Looking at the way this foot is, clearly the shoe on the bottom is not set underneath the wall. It's scooting basically medially. If I enlarge this and then I darken the images and we look at our lines, again, in this case we don't have convergent lines, but we have divergent lines, and this is on the outside. In this case, the outside heel wants to be a little bit higher and a little bit lower on the inside toe. So in this case too, you'll notice that the joint spacings are more even, other than in the coffin where on the medial aspect we have a little bit more compression. So both feet show different things. Obviously, it'd be nice to get this palmar angle back up on the right front to minimize some of that the negative palmar angle and hoof pastern angle. So that's the left front, good hoof pastern access, good hoof pastern angle, and the right front is broken back, broken heel, have room to trim a little more quarter toe, possibly even lift the horse up a little bit. Trying to fix the medial lateral balance, I think, might just come by giving the horse a little bit more shoe on either side, and obviously the right front, the shoe had shifted quite dramatically and is compressed medially versus on the right versus the left, which we have lateral compression. So that is my summary.